We're very happy to have you all with us today. We are going to be talking about effective communication strategies, formal partnerships, and leadership engagement. This is our State Technical Assistance webinar, and we have our funding sponsor information. Our project is supported by HRSA of the U.S. Department of Health and Human Services, and of course any information, content, and conclusions are those of us and should not be construed as the official position of the government. We have some technical tips. Audio is being broadcast through your phone lines. If you are on the phone line, please mute your computer speakers to hear and be heard, as I'm sure you've all done. You can call into our number. If you are being muted, but we will have some opportunities later to chat. We have some resources at the top. We have a PDF of our slides for today and some links at the top of our in our pod shares. And we will be using the chat function, the question and answer at the bottom left at any time. You can please enter anything you would like to share in there. And we are recording the session, so it will be posted on our calendar, so if you would like to share the recording later on with some of your colleagues who weren't able to participate today in person, you will be able to share that with them. Great. So my name is Maria Cotratis. I'm a CSLC Training and Technical Assistance Associate. I'm also the CSLC Data Director, so I'm sure you've received, if you're a part of the CSLC, you've received a number of emails from me. We have two guest speakers today, and we're very excited to have them both. Our first speaker will be Kerri Nickerson, who is the Director of Grantee and State Initiatives at the Suicide Prevention Resource Center. And our second presenter will be Deena Liska, who is the Teen Driving Coordinator at the Children's Hospital of Wisconsin Community Health. So, without further ado, we'll get started with Kerri Nickerson. Kerri, thank you for joining us today.
Great, thanks, Maria. Well, hello, everyone. I'm really delighted to be part of your conversation today, and I see actually some familiar names and faces in the virtual room, which is really exciting for me. So, as Maria said, I am the Director of Grantee and State Initiatives at the Suicide Prevention Resource Center. And similarly, anything that I say today should not be represented as views of our funder, SAMHSA, or the federal government. So for those of you who aren't familiar with SPRC, we were funded in 2002 by SAMHSA, and we serve as basically a resource destination for anyone who's looking to learn more about suicide prevention. So I hope if you haven't checked out our website, please do so after today. And I lead the team here that provides consultation and support to Garrett Lee Smith Youth Suicide Prevention grantees and other SAMHSA grantees and state suicide prevention coordinators who are looking to improve their suicide prevention efforts. So on to our main topic. So in the suicide prevention field, we're guided by what we call the National Strategy for Suicide Prevention that was last updated in 2012. And there's a couple goals within this national strategy that cover communications work. So just to set that background. So the National Action Alliance for Suicide Prevention that SPRC is a secretariat for is charged with changing that public conversation as it relates to the National Strategy for Suicide Prevention. And it's actually one of their 4 priority areas that they've been focusing on. And so just to make sure we're all on the same page. So what do we mean by public messaging? So here we mean anything that is public-facing information, so that could be campaigns, social media, newsletters, public events, website materials, fundraising materials, but the things it doesn't include are things like private conversations that you may have one-on-one with an individual, doctor-patient interaction, and other things like trainings delivered to very specific professional audiences. So just to kind of get to know you guys some more, what are some ways that you are currently communicating with the public? What are those public messaging channels that you currently use? And you can type that into the chat. Okay, so I see some social media. That's probably pretty common for you all. What else? And website. Okay, so we've got more social media, blogs, e-newsletters. You also have a website. I bet a lot of people have websites that they're using as part of their messaging as well. Okay, so feel free to keep typing, but I'm going to move us along in the interest of time. So that National Action Alliance for Suicide Prevention that I mentioned, as part of their priorities, they developed a framework called the Framework for Successful Messaging. And this consists of 4 parts and really is meant to guide those in the suicide prevention field, but it's really applicable to other fields in ways to ensure that you have successful messaging. So I included the link on the slide as well if you want to find out more information. We're going to be focusing in on that strategy piece today. So as you'll notice, strategy is really front and center in the model. So we want strategy to be at the heart of our communications planning. So the very first question you want to ask yourself is whether it makes sense to use communications as part of your prevention strategy in the first place. You may find that your goals focus around something that communications may not really suit. And also, I think an important thing to note is that communications work can also take up a lot of time and resources. So when you're about to embark on, say, a communications campaign or start a new blog or something like that, it's best to think about whether that's the best use of your limited resources. Another part of the strategy piece is starting in the right place. So there's often a temptation to jump to your delivery method and say something like, oh, well, we need posters. We should just start developing some posters. But instead, you want to start with the why. Why are you using communications? And then get to the how. So the National Cancer Institute has a really useful resource called Making Health Communications Programs Work, and we lovingly call that the Pink Book. The Pink Book makes some excellent points about what we can expect communication campaigns to do. So communication materials can't magically resolve issues related to access to care, and we also can't expect a single campaign or material to lead to sustained behavior change. For this to happen, communication materials really need to be part of a larger, broader strategy. We also need to recognize that messaging may be more of an effective tool for some problems or issues than others. So this is to say that many problems will not always be solved by messaging or messaging alone. So, systematic planning is really at the heart of that strategy piece. So on the left, you're going to see a list of key planning steps you'll want to take as you plot out your communications work. And we're going to walk through a couple of these in the rest of my presentation. But the important thing to note here again is that how piece, so whether you're making posters or creating a social media campaign, that really doesn't happen until much farther towards the end of your planning process. So what do we know about what leads to successful communications materials? It probably comes as no surprise, but successful communications materials are systematically planned with lots of time dedicated to the planning process, like the one I highlighted on the last slide. They also need to be tied to an overall strategy, so looking back at what was said with the with the Pink Book. And also, it seems really basic, but our communications work has to have specific objectives and a clear audience for which we want to receive those messages. And additionally, one of the big pieces that I often see missed is a clear call to action about what we want people to do after they see our messages. And we also really want to be framing the message to be tailored based on your specific audience and know what their motivations are to encourage that change. So we'll dive a little deeper into that one in a little bit. But another piece to this that's really essential is making sure that you pre-test your materials. So I always like to use the example that, you know, as someone who's now a mom of a certain age, I may think something sounds great for a teenage audience, but I may give it to them and they may think it's completely different and may not come off as intended. So we really need to include our target audience so that so that we can make sure that what we're putting out there is what we intended. And then the last piece that's really important that often gets missed is that our communications efforts need to be evaluated so that we can determine how successful they are and help identify if any tweaks need to be made in the future. So we have another chat question. So how do you see communications fitting into your overall efforts? How do they help address your health issue that you focus on? And I'll give you all a couple minutes to type in. Okay, so to reach a broad audience that might not otherwise be engaged, raising awareness and connecting people to services, reinforce the foundation of the work, contextualize the problem and illuminate potential solutions. That's great. All right, I see a couple other people typing. I'll just give another second and then we'll... So as we can see, people are kind of using communications in some different ways, but I think a large piece that I'm seeing here is helping highlight what is available and helping people understand the issue some more. Those seem to be kind of undercurrents from the chat there. So a couple more questions you guys want to ask yourselves as you're thinking about what role communications has in your work is doing a bit of that additional foundational research around, you know, what else is being done in this health area? Do I have a full scope of all the different pieces, and where does communications stick into this puzzle piece? And then, you know, I mentioned it before, but one of those last questions there you want to ask yourself is, what is your organization's capacity? This may help determine what level of a campaign or whether you want to embark on some sort of social media campaign that involves something like Twitter, where you'd be maybe having to post a lot and be constantly thinking about what you're going to be putting up next. Help you kind of determine where you want to go based on the level of organizational capacity you have. I also think it's a good time to think about what strategic partners you have or other folks who may have an interest in this work, like youth interns or other folks who can get involved and help you with this as well. So, and you guys shared some thoughts about the problems you're working on and how you're using communications. And the next step here, once you've kind of done some of that work about what you're trying to address, is to also think a little bit more about your audience. So who's most influenced by this problem and why, and what steps are you already taking? So you'll see I keep saying things like, what's part of that comprehensive strategy that you're using, and how can messaging help complement that? Additionally, once you've identified that group of people who are most influenced by the issue, it's time to look even more critically on how you can narrow in on your audience even further, and think a little bit more about what you've learned from that formative research and put that into practice in terms of thinking about what messaging would be most useful for that audience. And I would say this is probably one of the in the top 5 challenges that people face is identifying that clear audience for your messages, because I think too often we're tempted to create a campaign that addresses just the general public. And while this can be successful, this approach really limits your possibilities for success. And here's why. So I mentioned to you guys that you want to think narrowly about your audiences because each individual portion of your population may have different pieces that you'd want to consider as part of that campaign, and may have differing barriers at play, may have differing attitudes and beliefs, all of which that you could help address more successfully if you really narrow in on that audience a little bit more. And so, you know, that's not to say that you can't have a campaign that covers multiple different audiences, but you'll want to think about how you can kind of narrow in with each individual piece on that clearer audience that you're hoping to reach. You may also want to consider who your primary and secondary audiences are. So your primary audiences are also known as the target of change, or the person whose behavior we hope to ultimately change. And the secondary audience is also sometimes called the agent of change, or someone who has influence over the target of change. So, for example, you may have a goal of changing a behavior in a specific youth population. The youth are the primary audience, and their parents could be that secondary audience as they have influence over their children's behavior. And you may find that it's more effective to address those secondary audiences or agents of change with your communications efforts versus focusing just in on those primary audiences. So once you've narrowed in on your audience or audiences, it's time to think a little bit more critically about your objectives. So what is it that you hope your audience will do after seeing your communication material? And how does this tie in to your overall program goals? So this is also one of those top things I see a lot is folks not having a clear goal can really make it difficult to kind of narrow in on what exactly you want to do with your limited availability in that short communications that you're going to be doing. So in the suicide prevention field, it's not uncommon for people to say that their communication objective is to raise awareness. And as we've seen, I think that's also a goal across other health issues as well. But I want to suggest that in an attempt for to help people understand the scope of the problem, we sometimes paint a really bleak view of the issue that we're trying to prevent. So in looking at a couple different public opinion surveys around suicide, the general public tends to already understand that it's a problem and generally are supportive of prevention efforts to address these issues and that it can be a preventable thing. What gets lower scores in these surveys is knowing how to take action. So we really may be missing those valuable opportunities when we just focus on the severity of the problem. Also, while it's not an actual campaign material, this image is not something uncommon we used to see in the field. And the goal for an image like this or poster like this may have been, well, we want to raise awareness and encourage help seeking for youth. But does that image really make anyone want to go out and seek help? I'm not sure. So one of the things that the Action Alliance did when they were creating the framework was pull together an expert panel to help inform their efforts. And I really like this quote that came from it, and it says, "It's time to shift from communicating for awareness and communicating for action." So in general, just educating people about the severity of a problem is unlikely to lead to behavior change. And as we were saying, it may also make people feel like the problem is so big that it's hard for them to see how they can help. So instead, we want to think about what will actually lead to behavior change. And how would we do that? How would we change behavior? And this is a hard one, but the answer often lies in your audience research and what you've done to kind of get yourself to this point. So what do you know about the attitudes and beliefs about the issue, and how can you work to correct any erroneous beliefs that may have come up? Also, have you addressed any of the barriers that may keep them from that behavior that you're hoping will happen? It's really essential, and I can't state this enough, to have input from your intended audience, because it really ensures that the materials you create address their specific needs and are relevant, but also have a real relevancy to that group. So to that point, a couple other things that we've seen in terms of characteristics of good messages and communications materials. And out of interest of time, I can't really list all of these, but I think what you see in this is that piece about tailoring to the group that your specific audience, making sure you're understanding what unique cultural considerations might be at play, and also, again, really actively engaging them in the work that you're doing and helping to craft the messages that you're creating. So I want to just shift gears in the last few minutes that I have. Oh, wait, I apologize. We actually had a chat question. That's right. So if you want to just chat one last time, how have you engaged or plan to engage the populations of focus for your communications work? Okay, so through focus groups. Great. Focus groups are a great way to kind of get to hear a little bit more, get in-depth feedback, calling individuals affected by the issue, developing a stakeholder survey, and some parent input. Great. Okay, well, feel free to keep chatting those in, but I'm going to move us along for the interest of time. So for the last few minutes I have, I wanted to also just talk about how these principles that we just talked about apply to how you garner support from key stakeholders or create lasting partnerships. So I think a lot of the principles we discussed can carry over, and it really goes back to that formative research that we were talking about previously. So whenever you're thinking about your partners, it's just as you would imagine a target audience. So what stake do they have in the problems you're trying to address? Also thinking a little bit about what do they see as the issue and how are you specifically addressing their concerns? So many times those partners that we have are really busy and they have specific goals and need to hear very clearly how you're going to tie into the work that they're trying to accomplish. Along those lines, thinking very clearly about that message. What do you want them to know? What do you want them to do as a result of whatever you're communicating to them about? Similarly, this is, again, where you want to think about how do you bring a call to action to your communications whenever possible so that it's clear what you're hoping people will do as a result of what you're presenting to them. And lastly, you just want to think about what in particular would be most compelling to them. Is it a story about a family you helped as part of the efforts you were doing, or how much money you've saved the county as a result of work you've done? What is compelling to them? And along those lines also, what are the best channels for someone to receive this information? So sometimes that means having a senior leader talking to a senior leader, thinking about who is the right one to kind of deliver that information that you're hoping to convey. And then the last piece that I think gets missed a lot in the prevention work is not forgetting to toot your own horn. I think so often we do really good work out in the field and don't take a moment to think about how this should be conveyed to your communities, to your funders, to your key stakeholders. How do you make sure they understand all the good work that you're doing? And that can take some thinking about how to do that effectively, but it's really important that we show people all of the good work that you all are doing. So with that, I included some resources here, including that framework for successful messaging. Also, we have some small video clips as well on our website where you can learn a little bit more about strategic communications. And I believe there was a question about evaluation, and there is a video in that on our website that covers evaluation, but I can also chat a little bit more about that as well. And so I will pause there and see if anyone has questions.
Great. Thank you so much, Kerri. Please feel free to chat in your questions on the left. We did have a few questions and comments, one about the evaluation methods, and another comment about audiences that don't see themselves as the audience. So I'm not sure if you have anything to add about that, Kerri.
Yeah. So in terms of evaluation, so there's a couple different levels of evaluation, and we could probably spend a whole one of these sessions talking about it. But you can think about, one, both process measures. So in terms of things like social media, how many hits are you having, websites, how long are people staying on certain pages, are they clicking through to things? But then also you can try to do some other types of evaluation where you're either looking at specific audiences that have heard the message. Are you seeing any differences in the health issue in that specific area? Maybe also doing certain key informant interviews to understand a little bit more about what people may have done differently as a result of seeing your messages. There's a lot of different ways you could kind of take that. I'm curious if anyone here has examples of how they've been evaluating their work, and I don't know if maybe people want to chat any of those in if they have good examples that they want to share with others. And then in terms of when people don't see themselves as the audience, I think that might be in that first step of building support among your stakeholders without knowing too much about the specific issue in your community. I think the first part I would ask about that is, are they supportive of your work? Do they understand what you're doing and why? And understand why it would be worthwhile for them to be part of the work that you're doing. And maybe it's thinking creatively about how they can be involved, but I think, the general point to me is how do you kind of make sure that people feel like their involvement in something is relevant and making a difference in something that they feel is important. I don't know if that kind of gets to that question.
Great, thank you for sharing that. And Samara has added some more information about proof of performance from resources used, like billboards, radio analytics from social media, and I see that Jane Hairway is also adding in some more information. Here's a question from Jane. Does SPRC have a collection of the right sources images as examples?
So if you visit that framework for successful messaging, there's a couple pieces of that framework that talk about safe messaging. So specifically to suicide prevention, we know from the research that some language and highlighting certain things like specific means in which someone may die by suicide can increase the risk for those who are at risk for suicide. So there is some discussion there, though not specifically these are good pictures to have. But I will tell you that one of the rules we have here at SPRC is the no head clutcher rule. So we talk about, as you saw with that picture that I showed you on the Moving Beyond Awareness, that girl who was holding her head and was really sad, we want to also show, we want to help promote a positive narrative that recovery is possible, that hope is something that we should focus on. So we really try to promote in our materials and for others using images that show that positive narrative. And so the no head clutcher thing is a little bit of a simplification there, but thinking about, does this picture look very sad and depressing? Would this help someone see hope in this situation? That kind of is some criteria you can help as you're thinking about these things. And I do think there's a lot of comparisons for other health issues as well there. So do you want to show sad, upsetting pictures when you're trying to show people that this is preventable?
That's a really great point. Showing hopeful images instead of sad and depressing images. I saw Jeannie Beats was typing in, and Jane is also typing in as well. We'll have a few more minutes for questions for Kerri. Oh, and Jeannie is mentioning health educators versus deaf educators.
That's very true.
Great. And Jane is also asking, and do you have interview guides for the types of questions to ask when gathering input from individuals with life experiences?
That's a great question. I do not think we have any sort of ready-made sets of questions, and that may also, it may look different depending on, what your health issue is and what you're looking to do. So, I think part of this is just taking a look first and asking yourself or your group a question about what do we know already, and what kinds of questions do we need to ask to get to the answers that we need to understand this more.
Great.
And one other thing I will just add, one other thing I'll just add, Maria, it doesn't totally get at that question, but also in the framework for successful messaging, another portion of the framework was on guidelines, and within that section, it lists specific types of guidelines you may want to look over as you're thinking about working with specific populations. So that was one of the things that the Action Alliance wanted to do is think strategically in that framework of what would you need to know about your audience in order to kind of understand it more. So there's also that component that you could look at as well.
Great. Thank you so much. Kerri will still be on the line, so if you have any questions for her that you think of as we go along, you can always feel free to chat and put them in the chat box and indicate that they're for Kerri. We do have the link at the top for the SPRC Strategic Communication Planning documents, and we do encourage you to go to the SPRC website and check out all of these wonderful materials that Kerri has mentioned. Here's also Kerri's contact information, so if you would like to contact her with any questions after please go ahead and do so. Thank you so much, Kerri, for your wonderful presentation and for joining us today. We're very excited to have had someone from the Suicide Prevention Resource Center on our call.
Great. Thank you, Maria.
Great. Oops. So as we transition between thinking about the strategic communication planning and going into the more state perspective from Wisconsin, we wanted to have you chat about what was an effective communication or campaign material that you've received in the past, and why did you find it effective? If you could please chat at the bottom as we move along. It would be wonderful to hear your thoughts about something that you personally have received and that why you found it effective. Okay, Terry from Tennessee is mentioning, he says, I am finding myself more and more apt to pay attention to YouTube messages. Okay, and why in particular do you find them effective, Terry? Great, so it's easy for him to absorb, better than a pamphlet. Interesting. Great, and I see a few more folks are typing in, so we'll wait for their entries. And oh, Samara entered at one end TED Talks, and on the other end, your simple thank you note. Great, so these were effective communications. Wonderful. Oh, and Terry's mentioning podcasts as well. Becky and I were just talking about podcasts. Okay, Deborah is entering posters and other such materials have been helpful with getting messages out. Banners have been supplied for our students to pledge. Okay. And Mandy is entering the campaign that was in Sussex County in England about wearing seatbelts. There are no words. It evoked emotions about possibly losing family in a crash. So it was an emotional response to the images. Great. Thank you all for entering this information. It's really helpful when we're talking about effective communication and campaign materials. It's really helpful to think about what have we received in the past. Great, and Deborah's mentioning also Twitter and Instagram have also been helpful. So these are small snippets of information that we're receiving, and some may be more effective than others. So with that, we'll move on to onto Deena's presentation. So Deena is going to be presenting on Wisconsin Graduated Driver License Improvement Plan. And Deena, you can take it away.
Thank you. All right. So I wanted to just tell Kerri thank you for laying such beautiful groundwork for the content that I'm going to share as well. This might help to be a specific example of some of the things that Kerri was talking about. I would also like to just mention there are a number of Wisconsin team members on the call. So if you guys could just share in the chat that you're here and what agency you're representing, I think that would be nice for everyone listening to see the depth and the strength of the team that we have, because I think that's one of the key components to the work that we're doing. Just a little bit of background about the work that we're doing is we are part of community services at Children's Hospital of Wisconsin, but we also partner with other agencies and entities. We are working with the American Family Children's Hospital in Madison, with our other hospital systems in Wisconsin. We also work with our Ds, as we call them, DOT, DMV, DHS, DPI, and DOJ. Those are all of our government agencies that support our work and whose strategies and missions we are trying to support in return. We are part of the Maternal Child Health Program in Wisconsin. We are part of the Violence and Injury Prevention Program in Wisconsin. And we are also connected with Safe Kids, Child Death Review Teams, Injury-Free Coalition for Kids, and the Children's Safety Network. We were part of the Teen Driver Safety Coin for the last 2 cohorts, so that you have some background of what we're bringing, the perspective that we're sharing here. We've had a lot of help in getting to the point that we're at. So we're going to talk specifically about graduated driver licensing. Every state has some form of graduated driver licensing, although the requirements vary greatly from state to state. So Wisconsin first adopted a graduated driver licensing law in 2000. And our graduated driver licensing law does 3 things. First, it establishes the requirements for each stage of licensing. So what do they need to do to move from instruction permit to probationary license to regular license? And then it sets limits on nighttime driving, and it sets limits on peer passengers that can be in the car. And the most recent data that we have on this was for the first 3 years that GDL was in effect. Wisconsin saw a 15% decrease in the number of motor vehicle crashes involving 16-year-old drivers. So we did see some success from our GDL. So our initial intent with the Graduated Driver Licensing Improvement Plan was to strengthen our law by changing our policies and involving our elected officials and trying to perhaps strengthen our law from 30 hours of supervised driving to 50, or increase the hours that are restricted at night. So those were our initial thoughts. As we brought stakeholders to the table and had conversations, we started sharing data, we started doing some policy assessment, and we did some small-scale surveys of parents and teens and some of our partners. And as we did that, we realized that maybe the climate was not appropriate for bringing forth some legislation at this time. We also had our Safe Kids Coalition and our child passenger safety partners in the state who had taken an opportunity to propose legislation around rear-facing until 2 years old. And although their efforts at that time were not successful, we saw families coming into our checkpoints saying, I know my child has to be rear-facing until 2. So they were reciting to us best practice. Even though it had not become law, it had become accepted best practice to those parents. And so we looked at that and we thought that that might be a better approach for us to take, is to change the public will, change the dialogue around graduated driver licensing before we tried to steamroll some legislation through. So we started with a ground-up awareness campaign. And I really appreciate the things that Kerri said earlier about campaigns being systematic, connected, or linked to the overall strategy, including a call to action and being audience-specific and tested with the audience. Those are all key things to the approach that we used also. So I'd like to show you how we developed our approach. The text on here is a little bit small, but you'll be able to see it better in the slides if you look at them after. But we are using a systems approach. The little circles down at the bottom right-hand side are the socio-ecological model. So the blue, which corresponds to the blue on the chart, is the policy and the society level. The purple is the organizational or community level, and the green is the immediate circle, the family and friends, and then the gray is the individual, but we know that teens are influenced by the people around them a significant amount. And so we focus our efforts in those upper 3 family, community, organization, and societal levels. So what I'm wondering is, if you could just share in the chat box, which of these levels are you currently working at or working in? And maybe if you wanted to share your topic area, also go ahead and do that. But I'm curious if you are working in all of these areas or primarily one of these areas. If you could please share that, that would be great. And I see some of you are responding. Thank you for that. And as we have worked through this as a state, we often see ourselves moving up and down those colored bars of the chart. So depending on the opportunities, depending on the funding, depending on some of the barriers that we might be encountering, we sometimes will move heavily into one area more than the other, and then move back when maybe the climate or some of our experiences have changed. Okay, so if you'd like to keep adding, go right ahead. And I'm going to move us forward. So we started with the systems approach that we just looked at. And then we also looked at evidence-based strategies around teen driver safety. So we know that graduated driver licensing reduces risk by making sure that teens gradually build experience and that we reduce their risk initially while they're learning. We know that nighttime driving and peer passengers can increase their risk, and so limiting those things can reduce the risk. We also know quite a bit about some of the other factors in teen crashes, such as speeding, distractions, low seatbelt use, impaired or drowsy driving. And we also know as an evidence-based strategy that parent involvement can reduce the risks. And so these were the major talking points that we used in the development of our strategies and our messaging. We also made sure that it was inclusive as we developed our messaging, that this isn't just a teen issue, that GDL protects all drivers and helps all drivers to be safe on the road. So our messages were really pretty straightforward based on what we know from strategies that are effective. We also used a couple of models as we started to look at how we would evaluate the campaign. So 3 of the things that were very helpful to us is the Harvard Family Research Project has a great guide to planning advocacy efforts. And the Knight Foundation has a terrific guide on evaluating community information projects. And so we pulled from both of those resources. And then as part of the Child Safety Coin, we also used the Teen Driver Safety Change Package to structure the work that we're doing. And it also helped us to structure the talking points and the messaging that we were using to communicate with other partners and other professionals. So from those resources and all of the information that we gathered, we developed a theory of change. It's a lot of people will use a logic model or the change package, and we just adapted that concept into this theory of change. So at the top in the blue, you can see there are activities, there are project level outcomes, community level outcomes, and then societal level outcomes. And so in some charts, this would be immediate, medium-term, long-term that you'd be seeing. So some of the first things we did is to create some print materials so that we had common messaging that was being used with all of the partners and all of the programs and all of the areas that we intended to work. So we had common messaging. We provided print materials and electronic content, and we participate continually in coalition building and community activities and monitoring issues and advocacy interests. So we continued to do that, but we also focused those efforts on teen driver safety and graduated driver licensing. So the next stage is once we had those materials starting to come together and starting to form those basic materials. We wanted to increase the message reach, increase the engagement from the audience, and increase the availability of resources. So we wanted to make sure we were getting materials out, but we wanted to make sure also that we were getting communications back. And some of the feedback that we got from surveys and from parents is that they didn't know where to go to find information. So having increased availability of resources was really important to us. So if we have those materials and if we increase the reach, engagement, and availability, the next step should be community outcomes, and the next step then should be society outcomes. So I'm going to show you some of the materials, and then I can talk a little bit about our initial results. So you're seeing just a snippet of some of our materials. The blue little teen driving piece on the left side of those three is our wallet card. It is wallet-sized. It's designed to be kept with the student or with the parent, and the thought behind that was that it would increase behavior change if it was handy and where they needed it at the time they needed it. So the wallet card is truly driver license sized. It contains all the same information as that big fact sheet that's on the page behind it, just in miniature. So it has all the licensing stages, it has all the restrictions, it has all of the information that they need during each step of their licensure to follow the law and to drive safely within the requirements of GDL. We had parent and teen review of the wallet card, and we also had review of all of that content by our Department of Motor Vehicles, Department of Transportation, our driver ed community, and our law enforcement community to make sure that we were wording everything correctly and that we had correctly stated the law as all of those different groups understood it. And then the piece on the lower right hand with the green on it is the flyer card for our videos. We also created a number of videos. One of them is just a general video about graduated driver licensing. The second one is a video of teens telling their stories about what they've learned about driving. And the remaining pieces are things that talk about the amount of practice that it takes to be a good driver. This was an interesting piece for us. We used all local teens, I'm sorry. At every step of this, the teens were involved in reviewing this. So they reviewed the concept for each of the videos. They reviewed the video scripts in the ones that had scripts. And then during filming, we had teams dedicated just to observing the filming environment and making sure that we were being responsive and receptive and capturing the content in a way that they felt comfortable with. We pulled local teams together to do this, and it was interesting that all of them had a story of a crash or an experience or some lesson that they had either learned on their own already or learned in the car with a parent. So just randomly selected teens were able to share stories with us, which told us a lot about the scope of the experience that they already had with motor vehicle safety. We also are in the process now of developing specific materials. As Kerri talked about, identifying the audience is really important. So these are our general materials designed for the general community, adults and teens. But we are also working to roll this out in specific projects now, not just on a display rack, but actually as part of an intervention with our law enforcement agencies, with our primary care, and with our driver educators, so that there are more depth to the pieces that are being rolled out then with those specific providers. So our initial results so far is we created a number of materials, which you saw, and then we're working at the project outcome level right now, primarily. So we're measuring the materials distributed, we're measuring the views on our website and social media, Facebook and Twitter likes and shares, the contact us forms, the order forms for resources, and then the number of partners that are distributing our resources and how. So what I'd like to do is show you the tracking sheet that we use. These are just some of the initial results, some of the numbers that we've reached, and you're free to go ahead and read through those on your own if you'd like to. But the more important thing is how it's contributing to this level of change. So in that first, on the left-hand side is showing 2018 in the first blue column compared to 2017, and our numbers reached for each of those years. So within Crossroads Teen Driving, there is 1.6 full-time employees. So for us to reach much beyond those first three lines is really difficult with the amount of staff that we have dedicated. So what we are looking at is when these resources are more available and our partners are engaged, that reach will increase. So you can see we have it broken down by the increased distribution of print materials, the increased distribution of electronic media, the increased audience engagement, and you can see specifically how we're measuring that. So the website contact us forms, the website resource order forms, when somebody not just views Facebook but clicks, reacts, or comments, the number of new followers, our newsletter opens, and our newsletter click-throughs. So those tell us that our audience is looking for additional information or looking to interact with us in some way. And then you see the increased availability of resources is the number of partners distributing and the number of resources created. And then just below there in all those blanks where there is no data, you see some of the evidence of community and societal level outcomes. We're too early in the program to see a lot of those right now, which is why you're not seeing data in those sections. But we do have benchmarks or indicators to tell us when we're starting to see some of those numbers. And at that time, we'll develop specific measures to capture the impact of those efforts. So then on the right side, you're seeing January to January of 18 to 19. And you can see that our distribution of electronic media is significantly increased. But you can also see that we're increasing our audience engagement. So January is typically a slow month for us with schools coming back from break and having snow days and things like that, and no national campaigns that we are piggybacking on. So even in a slow month, we're seeing increased engagement from our audiences. And you can also see now, as we've started to move into the community and societal level outcomes with this campaign, we're seeing that our number of partners has grown from 20 or 30 last year overall to 70 this year. So we have 70 partners January of this year, and last year we had 36 altogether. And we also are seeing now community level outcomes that are part of a structured program and structured tracking that we are engaged in. And those numbers should continue to increase now over the coming year or two. So this is just an example of some of the planned activities that we have for 2019. We're going to continue to distribute our electronic media. That seems to be the one that gets the most response. As some of you mentioned in the question at the beginning of the session, podcasts and electronic media, Twitter, social media are really effective ways of reaching our audiences. So we're going to continue to do that. We're also going to continue to promote our graduated driver licensing videos. And then we're taking the materials that we have created and the materials that we are creating and building interventions and programming around them. So they're not just standalone handouts. They're actually part of a better education effort and with more content, more delivery. So I'm curious to know at this point if there are any takeaways or if there's anything that you are currently doing that you would like to do more of, that you think is successful, or if there's something you've seen in the presentation that you'd like more information about. And while you think about that, I'm going to just summarize three of the things that we thought made this a successful initiative. First is we started with a clear vision of how this campaign fits into our system of improvement. It was a coordinated effort, and it was deliberate. It wasn't based on materials. It was a deliberate development based on our system of improvement. We had great support from our key stakeholders, and they were engaged and they were very supportive of the direction we wanted to take. We also have multiple funding sources. We have state and federal funds, and we have private funds, which is a key piece for us to be able to develop great materials that look good and resonate with our audiences. And then, as I mentioned before, with only 2 of us engaged in this work right now, we depend on our state and local partners to be part of this network, part of this solution. And so working with them and making sure that our goals align with their goals and that we're supporting what they need to be able to do and report on has been a critical piece of this. Those partnerships are really the foundation of the work that we've been able to accomplish. All right, so I think we have time for questions. And I will put my contact information up here. Our website is also there if you would like to learn more about the work we're doing. And the link to our videos was in the chat box, but it's also on our website if you need it.
Great. Thank you so much, Deena. We have received some comments in the chat, so I'd like to bring those to your attention. We have a comment from Kurt saying parent involvement is very important and often parents are not. And a comment from Jeannie Beats saying, I like the systems approach and having a written plan to help in keeping on track and bringing partners to the table.
Thank you, Jeannie. That is one of the pieces that's been really helpful for us also, is to have a written plan that we can use to communicate with our stakeholders and partners. It makes it so much easier to show them what we're hoping to accomplish and to see how it might fit with the work that they're already engaged in. And Kurt is actually one of our partners who is in the southwestern part of our state, and he works with the driver education community in the CISA, and parent involvement is one of the challenges that we are working on together to try to figure out how to get the parents in the door, because once they're in the door, they understand the importance of the message and they understand what they need to do. And so we're working through how do we do a better job of getting those parents in the door. I appreciate the discussion.
Yeah, it's a really great point that often the parents are just interested in relieving their own responsibilities around driving kids around. But they're not realizing how important their part is in their teen safe driving. Great, yes. And students do also get bad habits from watching their parents. Great. So we're seeing some overlap between the two presentations, and I hope that you're seeing some overlap as well. Kerri was presenting much more of the planning and strategic communication planning, and Deena was presenting much more of the state perspective of how does this actually work from the state side of things, and obviously giving there were examples from suicide prevention and also from motor vehicle traffic safety. If anyone has any comments or questions for Deena or even for Kerri, please go ahead and enter them into the chat pod. I particularly liked your mention, Deena, of having the systems thinking approach, and I will be chatting about that in just a few minutes. So if we don't have any specific questions or comments for Deena, we'll move along. But if you come up with any questions, Deena and Kerri are both still on the line, so you can feel free to type them in, and we will address them as they come in. Thank you so much, Deena, for your wonderful presentation. You're doing amazing work in Wisconsin. Thank you to the entire Wisconsin team that's on the call.
Thanks for letting us share today. We appreciate it.
Wonderful. So, one of the things that I wanted to bring this back to is the systems approach that Deena was alluding to during her presentation. And a lot of it is really defining your system. So the next couple of slides will be reiterating a lot of the systems thinking approach of where do you begin? How do you define your system? How are you defining injury prevention? These are very simple questions, but you need to be able to answer them for yourselves and also for communicating with your partners. Which populations are you aiming to impact? What is the boundary of your system? Are you working in geographic regions or with specific socioeconomic groups, specific demographic groups? What injury and violence-related outcomes are you trying to achieve? And I think Deena's example of looking at the short-term outcomes and then the long-term goals and outcomes was really important. Sometimes you can't get to those outcome measures immediately. So how are you going to measure all of your good work in the meantime? It was really helpful to see all of those outcomes lined up and charted so that we can see the most immediate outcomes of how many hits to the website and how many downloads do we have versus your ultimate outcome measures and everything in between. So, of course, we have different degrees of complexity that we're working in. We have system boundaries, and some of you may have seen these slides this slide before, but I wanted to bring it back up to remind ourselves that we are working in different systems, and some systems may be less complex, going all the way up to extremely complex. So what Deena was just presenting was a highly complex system where she's working in a statewide system. But some of you may not be ready for the statewide system yet. So you may be working on implementing a program in one school or in one school district or one county. So we really want to make sure that as you're planning your communications, you're really focusing on who is going to receive this messaging and who is going to join you at the table in preparing this messaging and getting the messaging out. So in thinking of all of this, we'd like you to think about what is the action goal of your messaging and what is the kind of messaging you need to get folks to take that action. So if you could enter that into the chat, the question boxes below. Um, that would be wonderful if you could enter some ideas of what is the goal of your messaging? What are you planning on working on? What are you currently working on? And what is the kind of messaging you think you need to get folks to take that action? Okay, so we have Jeannie Beats is talking about increasing compliance with GDL, and Terry Love is talking about intervening early in the suicide process. Could you explain that a bit more, please? Mandy Slag is saying that messaging that evokes emotion will hopefully get folks to take the action that they need. Great, so Terry's mentioning QPR, question, persuade, refer for suicide prevention. Okay, Washington is mentioning positive norms, and Jane Herway is mentioning a clear call to action. Great, Terry is saying that it's not just the program, the QPR, but also the attitude of intervention. Fantastic, thank you for sharing. Jeannie is mentioning on the right side of the screen, basic information to get a start-off level of what GDL is leading to agreements, leading to policy improvements. Okay. And Terry Love is mentioning for suicide prevention for older folks, maybe focusing on the wives, friends, etc. of older white men who are most at risk for suicide. Okay. Well, thank you all for those sharing all of that. Deena, would you like to add anything here?
Hi, thanks. At Lifesavers, we heard a really interesting presentation from Driving Change, which is a campaign playbook, and they referred to their messaging for drivers and cyclists as rule delivery. So it was phrased as a behavior that they wanted the driver or the bicyclist to use. We thought that was a really interesting way of thinking about the messaging.
Great. That's a great example. Wonderful. I see Melissa Ellis is typing, so we'll wait for Melissa and then we'll move on. Thank you all for joining us and for sharing your plans and your information, what you've been working on. It's really helpful. So Melissa's talking about bullying and other adverse childhood experience impacting student health. Okay. Great. So we'll move on. Thank you all for participating. So, of course, when we're talking about our system and thinking about our system, we want to think about how we can involve different components of our system in the work that we're doing. So you could, of course, create a system or process map for one of your strategies that you're working on or thinking about working on. And of course, this is part of the process, and it can be a part of your system. Of course, according to Deming, we want to make sure that we're directing all of the efforts of all of the components toward the aim of the system. And the first step is clarification. Everyone in the organization, your partners, and everyone who's working on it must understand the aim of the system and how to direct their efforts towards it. And everyone must also understand the danger and loss to the whole organization from a team that goes off the message, off message and off script. So we want to keep all of these in mind. This is the chart that you see on the screen is adapted from the improvement guide, and of course it takes you from engaging stakeholders and partners all the way up to establishing data collection and evaluation process. And this is iterative; it's not linear. So we want to make sure that you are considering all of these things and defining your system, and then finding the right people to sit at the table with you, and creating all of these messaging. As Jenny is mentioning in the chat, working in a complex system, it's important to adapt your message for the various audiences you're trying to address. You might have to evoke a different emotion or use different language imagery for each. And that goes into exactly what Kerri and Deena have been presenting as well today. That you want to know your audience, how they're going to receive messages, and how you're presenting your own message. Great. So we would like you to think about one last time before we go. We'd like you to think about what is a topic about which you've received or had a messaging campaign about in your state or jurisdiction, and what would you do to make that messaging campaign more effective? So we've had two really great presentations today that have given us a lot of great ideas of how to go forward with our messaging and campaigns. So what is something that you've had a campaign about in your state, and after all of these great discussions today, how would you make it more effective? Please take a minute or two to write in your answers under the question chats. I see a few folks are typing in. Thank you. Deena, do you have an example of something that you've improved over time, or Kerri as well? Something that you may have used in the past that you have improved to make more effective?
This is Deena. One of the things that we do is we have campaign materials that we send out to the schools. And initially we directed some of those activities, but the feedback we get from the teens is that they know what to do with those materials once they receive them. So just being receptive to that input from the audiences that we're working with helps us to be more effective on a continual basis.
Yeah, so because we're a national organization and focus on kind of broader resources, one of the things that we've tried to do with any of our communications work is getting a lot of evaluation from that and tailoring. So one of the things that we did is evaluated some online videos that we had on the SPRC website, realized that folks were kind of saying these were too long, and have tried to tailor a little bit more into those needs of a kind of a quicker style, what we call micro-learning videos. So it's not as direct as maybe what Deena is mentioning, but I think that importance of tailoring based on feedback.
Great, thank you both for those great examples. We have a couple that have come in our chats. Jane Herway in Louisiana mentioned that they've had a messaging campaign about self-sleep, and that it was well planned and had many of the elements from the Pink Book, but she's not sure it has been evaluated. Melissa Ellis mentioned parent outreach with DDL, and they included youth involvement, or they could include youth involvement in drafting campaign materials. Deborah Paradowski mentioned distracted driving, buckle up, phone down. That's a really good name, Deborah, for a program. And Victoria Ladd in South Carolina said that they were working on campaigns on teen immunizations in South Carolina, and that they partnered with the American Cancer Society and changed the messaging related to HPV from the sex-focused vaccine to be a cancer prevention-focused campaign with good success, and that the rates are improving in South Carolina. That's great to hear. So we've had a couple of different examples. We have some more folks joining in. See Sarah and Kerri are typing. Great. Yeah, I agree as well, Kerri. That's a great example of focusing on the right message, the HPV example for South Carolina. Great. We'll wait for Sarah's input. And we're really happy. This has been a really great discussion. I'm really happy to hear of all of these examples and how you're planning on improving, making your campaigns more effective. Great. So Sarah is entering that they have a Safe Sleep campaign in North Dakota, and they put promotional materials in businesses, hospitals, and local public health units across the state. Great. Well, thank you all so much for your participation. I'll leave this open so we can, here we go. Jenny also entered, another consideration is how the message not only provides information about what to do, but also where to go for further information help. That's a really important point, Jenny. Oftentimes we receive information and it's almost a one-time interaction where we receive that campaign material and then we don't know where else to go for information, especially when we're dealing with kids and teenagers. We need to be able to have them access the information as well. And Sarah Macy also entered that they're using floor stickers that go on the ground in grocery stores and also in changing tables in the restrooms. Yes, and they are ubiquitous. I've seen them myself. Great. Well, thank you so much for all of your input. We'll move back. So we are all at CSN, we are in the process of continuous quality improvement as we are taking our states through continuous quality improvement. So we would greatly appreciate if you would fill out our evaluation for today's call. If you have any questions, you can please feel free to keep putting them in the chat box, but we are really happy to have had Kerri and Deena present on this very important topic of messaging and campaigns. And we hope that you found this, topic interesting and informative and has pushed your thinking forward. We really appreciate your participation today, and we hope you have a wonderful afternoon. Thank you, everyone.
Thank you.